Next question is in the name of Deputy Clare Daly.
Minister, you're aware that the former Master of the Coombe has said unequivocally that Ireland has long been skating on dangerously thin ice when it comes to our maternity services. His view seems to be supported by the phenomenal amount of money that the State Claims Agency has paid out in maternity cases, $379 million in damages and legal costs between 2007 and 2015. I'm wondering, are you concerned about the impact of patient safety of our crisis in midwifery?
I want to thank Deputy Daly for raising this very important matter. Only yesterday I visited the Coombe, and only last Friday I visited Holles Street, and the week before I visited the Rotunda. I do think it's fair to say that in years gone past, and it's not a political point, it's one levelled at all our doorsteps, our maternity services did not receive the degree of priority that they need to in relation to investment, and I am determined to fix that. And if you look, it's not just words, Deputy Daly. If you look at what has happened this year, we've seen the launch of Ireland's first ever national maternity strategy. Shocking in some ways that it is our first ever, but we now actually have a national maternity strategy that's been recognised as a really good document with great input from experts, but also from women who are, I suppose, the experts in relation to this. We've seen the publication of our first set of bereavement standards for women who are bereaved through pregnancy or neonatal death, again with direct input from women, from their partners and from midwives themselves, and a number of changes that is bringing to our maternity services. We have seen the plans to move the National Maternity Hospital, as I said earlier, to St Vincent's, because whilst there's excellent work going on there, it's simply not fit for purpose as a building, and women deserve a state-of-the-art, world-class facility. And we have seen, which I've just approved relatively recently, the HICWA standards for our maternity services, which I believe will be launched this month. I am aware of and concerned about increasing claims to the state claims agencies arising from maternity cases. However, I can assure the Deputy that the safety and quality of maternity services is a priority for this government. It's a personal priority for me. The publication of the National Maternity Strategy, as I've said earlier this year, I hope demonstrates a new and enhanced focus on maternity care at both policy and service delivery level, and provides a roadmap for how we can improve services in the years ahead. Of note too is that this month HICWA will publish the national standards for safer, better maternity services, the first standards we have in these areas. The standards will provide a framework for maternity service providers to ensure that they're meeting the needs of women, their babies and their partners, and that a consistent service is delivered right across the country. And I'm confident that the strategy, coupled with the new standards, does provide building blocks for safer, better services. With regard to as the Deputy knows, in 2014 the HSE commissioned a midwifery workforce planning project. That project will inform the allocation of new midwifery resources on a phased basis over the coming years. In that context, in May of this year, the HSE granted approval to the hospital groups to appoint an additional 100 staff midwives, and the majority of these posts were actually allocated to the 3 Dublin maternity hospitals. In line also with the National Maternity Strategy, a National Women and Infants Health Programme is being established within the HSE to lead the management, organisation and delivery of maternity, gynaecological and neonatal services.
Thanks, Minister.
And this programme will drive the delivery of that strategy.
Deputy for
implemented, and it's worth noting, Minister, that what followed it was a report on midwifery numbers, which suggested that in order to implement the measures in the report, we'd have to move to a midwife to birth ratio of 1 to 29.5, which would actually require the recruitment of additional 450 midwives, not the 100 that have been brought in. And while I welcome the 100 at a cost of $3 million, the point I'm trying to make to you is that there has been a 12-fold increase in damages, a 12-fold increase in litigation taken against women who have been damaged by our maternity services in precisely the same period that the budgets for those hospitals were cut. There's a clear-cut case now. Maternity cases represent more than half the claims in the State's Claim Agency, which is absolutely scandalous, and I don't think the link between the two can be denied. And I suppose what I'm saying is, why are all these women and families suffering for what? Like, we're spending the same amount of money on lawyers and legal costs and damages, that a fraction of that being spent into our maternity would transform the position, and we wouldn't need to do that.
I said at the outset, and I think it's an important point that we say it, maternity services in this country were neglected compared to other parts of the health service, even in years where the money was aplenty. So it can't just be put down to a kind of recessionary challenge. It was a thing going back right through generations in this country, and we've got to work collectively to rectify it. And that's why, and I know you say the National Maternity Strategy is a good document, and I note what you say, that it hasn't been fully implemented in any way, shape or form yet. It was published in January. It's a living, breathing document. We've got to get on and implement it. And we're using the same model to implement the National Maternity Strategy as we used for the National Cancer Strategy very successfully, as previous governments used. Rather than it just being a report, we're actually going to have a specific programme, a National Women and Infants Health Programme within the HSE to drive it. And I think that is, in fairness, by any objective standard, attaching a degree of priority to the delivery and implementation of that. For the record of the House, according to the October census, there were 1,402 whole-time equivalent midwife posts within the health service, and when you include midwives, midwife managers and other midwifery specialists, there were 1,934 whole-time equivalents.
Thanks, Minister. Further,
The National Maternity Strategy, sure, it only came in January. That's actually 11 months ago. And if we even look at measures like, for example, access to ultrasound scans, we know now, 11 months on, 13 of the National Maternity Hospital, or the maternity hospitals, do not have access to ultrasound scans. They haven't been able to recruit programme directors and so on. And in that sense, there's an inherent weakness in the strategy that there's no targets and no timeframes. And I don't think the point has been taken on board enough about the valuable impact of the need to deliver way beyond the numbers of midwives that you've sanctioned off. We need to double and treble that. Like you've said 100, and I obviously welcome 100, but the HSE spent $6 million last year on fighting claims in maternity cases. That would have allowed us to recruit 200 midwives, you know, and it's just we're going in the wrong direction, and it hasn't been implemented quick enough. I mean, we've had some horrific correspondence from midwives who are at the coalface of this crisis.